and I will start the live as well.
Great.
Hello.
Hello, everyone. We are currently finalizing a few issues. We will be starting in about 2 minutes.
Oh. Good afternoon, partners, friends, and colleagues. Welcome to this webinar titled Lessons from HIV, Addressing COVID-19 Stigma in Southern and East Africa, which is hosted by the AIDS and Rights Alliance for Southern Africa, which is also known as ARASA. My name is Felicita Hikuam, and I'm the director of ARASA. I have the honor of welcoming all of you to this webinar today, and also in moderating the discussion this afternoon. For those of you who are new to our organization, ARASA is a partnership of civil society organizations working in 18 countries across Southern and East Africa, which was set up in 2002 initially to promote a rights-based response to HIV. Recently, we have pivoted strategically to anchor our work in the core principle of respect for and protection of the rights to bodily autonomy and integrity in order to reduce inequality, especially gender inequality, to achieve health dignity, and well-being for all in Southern and East Africa. Before we get started, we have a few announcements to assist with your participation in this webinar. Firstly, you can follow the session in English, French, and Portuguese. To access the language channel, please look at the icons at the bottom of the Zoom meeting box, and next to the chat box icon, you will see one that says interpretation. You can then select this icon and choose the audio channel for the language of your choice. You can mute original audio so that you can only hear the interpreter. Please note that all the speakers for this session will speak in English, so there will be no need to switch between channels. Please also note that this webinar is being recorded and will be uploaded on the ARASA website, our YouTube channel, and other social media platforms. This webinar is also now being live streamed on the ARASA Facebook page, and you can feel free to share it on your social media from there. Please be mindful of revealing personal particulars and other information, including your name, your age, your affiliation, or country, if you are not comfortable for this to be public. You can also click on the 3 dots in the box with your profile and select rename to change your name if you do not want your name to be visible to others. In addition, we urge you to please keep confidences, which means that if you want to share something that came up in this discussion, you can say what was said and you can say who was in the meeting, but you can't say who said what. So you can't quote someone directly unless you get their permission. Also, please be careful about sharing details that would easily identify someone because of their institutional affiliation or their perspective. Please note that this webinar is a safe and neutral space for sharing of experiences and perspectives in a mutually respectful manner. While we understand and we know that you are all model citizens, ARASA has a zero tolerance policy for any kind of bullying, harassment, abusive use of language, aggressive expression of opinions, or any such undesirable behaviors. Anyone who engages in such actions will be immediately removed from the session with no prior notice. Also, please note that we will not make use of the raise hand function or allow participants to speak during this session. But we do encourage you to please feel free to share your comments and questions and thoughts in the Q&A text box, in the chat box, or in the Facebook comment section. Due to security reasons, engagements in the chat and Q&A may not be anonymous. So please watch out to share information that you do not want to be public. So now that we have the announcements behind us, a little bit of background to the session. This is the first in a series of webinars from ARASA that will be focused on using lessons from HIV to promote a rights-based response to COVID-19. I will outline the upcoming webinars at the end of this webinar. At ARASA, we believe that the protection of human rights is not only critical from a rights-based perspective, but also produces positive health outcomes. On the contrary, we know that the denial of human rights, such as the rights to non-discrimination, gender equality, education, health, privacy, and social assistance, increase vulnerability and result in negative health outcomes. Over the past few months, the world has been reeling from the havoc caused by a new public health crisis in the form of COVID-19 on the lives, communities, economies, and livelihoods of many people across the globe. And countries in this region are now experiencing a steady increase in COVID-19 cases and are seriously rethinking the effectiveness of their COVID-19 responses. Worst of all, it seems as if we are reliving the horror of the HIV epidemic as we learn about households being stigmatized and ostracized for housing someone diagnosed with or exposed to COVID-19, and that law enforcement officials can be overzealous and even heavy-handed in their treatment of marginalized groups, such as the homeless, people who use drugs, lesbian, gay, bisexual, transgender, and intersex persons, and street vendors while enforcing COVID-19 regulations. Sadly, it seems that we have not learned the lessons the HIV epidemic has taught us. Epidemics expose and exacerbate existing inequalities and inequities and impact most negatively on those who are already marginalized. As we grapple with what it will take to bring the COVID-19 pandemic under control, it is clear that we do not need to repeat the mistakes of other public health crises and can do better to integrate the many lessons HIV has taught us, including that human rights-based approaches and community empowerment must be at the center of any epidemic or pandemic response. This brings us to this webinar. Over the next hour and 15 minutes, we will explore what we have learned about addressing HIV-related stigma and how we can apply those lessons to COVID-19. To kick us off, we would like to get a sense of what perspectives you bring to this session. And in order to do this, we will ask you to please open a new window in your web browser. So on whatever unit you are using, on your phone, on your laptop, your iPad, your tablet, if you could go to the web browser you're using, whether it's Google, Chrome, Firefox, whatever, please open a new window and type in menti.com. Again, please open a window on menti.com. That is www.menti.com and type in the code 102368, 0 at the end. Again, the code is 102368, I'll give you a minute to do this while I remind everyone to please go to menti.com and to type in the code 102368. The first question we're asking you this afternoon is, which words come to mind when you think about HIV-related stigma? So this is specifically around HIV-related stigma. And the way that Menti works is that the words that are bigger are the ones that are mentioned most frequently, and the ones that are smaller are the ones that are not mentioned as frequently. So this means that the majority of people who are taking part in this poll think of the words discrimination, not discrimination, and then B, the change is another one. Transphobia and homophobia are also words that are coming up quite significantly when people think about HIV-related stigma. Process, criminalization, power, racism, fear, injustice, positive, STD, those are words that have been mentioned the least frequent. Again, discrimination, transphobia, and homophobia are coming out most strongly. The people who've joined us and are francophone or lusophone, please feel free to enter the words in your language of choice. So please feel free to also type in French or Portuguese if you would like to. And again, the words that are coming up the most frequently are homophobia, transphobia, discrimination, and now injustice. The ones that are mentioned least frequently are racism, fear, ostracize, barrier, racism, STD, isolation. But those are all really good words that actually explain and describe HIV-related stigma. We will give you one more minute to type in any words that come to mind when you think about HIV-related stigma. Again, it's at menti.com, so www.menti.com, and the code is on the screen. The words that are the biggest are the ones that are mentioned most frequently. The smallest are the ones mentioned least frequently. So the biggest ones, discrimination, homophobia, fear, and transphobia. Injustice and isolation have also come out frequently. The least frequent are stigma, self-stigma, barrier, culture, rape, STD. Interesting to see that there's also denial has come up now as a word. Ostracized has come up twice. So it might have been a little bit bigger if the word at the end was not left out, or the letter D was not left out. Harmful norms has also come up. And then otherness, that's an interesting one. Otherness has also come up. I think there's one that says process. Okay, thank you so much for everyone that has actually participated in that Menti question. The next question, and we're still using the same code, so you can just go to the next question. It is, which words come to mind when you think about COVID-19 related stigma? So the first question was about HIV related stigma. And this is now asking which words come to mind when you think about COVID-19 related stigma. Oh, interesting. Fear, that's one that was also mentioned in the HIV related stigma one. Misinformation, unscientific, those are ones that were not mentioned before. Xenophobia, fear is still big. Misinformation, marginalization, shame, knowledge, exclusion, discrimination, isolation, death is one that wasn't mentioned around HIV stigma, but has come up now. Fake, I've seen rumors, unknown, not facts has also come up now. Infectious, Donald Trump, I have not expected, I did not expect to see that name specifically pop up here, but there we go. There's someone that thinks about Donald Trump when they think about COVID-related stigma. And I mean, I don't know if many people can fault them. But as I mentioned before, the big words are the ones that were mentioned most frequently. The smaller ones were mentioned the least frequently. So fear is one that was mentioned quite significantly when people think about COVID-related stigma. There's also misinformation, contagion, isolation, and then least frequently, racism, déjà vu, indeed déjà vu, and fast, shame was also mentioned least frequently, but was still mentioned. We'll give it about 1 more minute and allow people to respond to the question, which words come to mind when you think about COVID-19 related stigma? Interesting, fear is still in the lead. There's also misinformation, contagion and isolation, and death that are at almost the same size. And then whole population has also popped up. Animal comes up. Now rumors, denial, exclusion, not facts, mask comes up. Conspiracy, bat eater, shame, racism. Okay, so let's conclude this question in responses to this question and then move on to the next question. It was interesting to see some overlap between the words that come to mind when people think about HIV-related stigma and COVID-related stigma, but also quite significantly the differences that have come up between the words that popped up between the two questions. So the next question that we have for you is what do COVID-19 stigma and HIV-related stigma have in common? So based on your experience, understanding, etc., what do they have in common? We've seen othering and marginalization is what COVID-19 stigma and HIV stigma have in common. Horror is one that was mentioned. Unscientific facts and myths. You lose self-esteem, fear, discrimination. Process. Stigma is about me. I can feel it. I can change it. The lack of knowledge is also something that people find is common between the two. Fear and death, losing self-esteem. Both of these are surrounded by disinformation, intentional disinformation of scientific facts. They have in common a lack of knowledge. They have in common that they both exacerbate existing inequalities or inequity. Fear is in common. They both involve fear, shame, disease, and people in large numbers. They're both infections. They seek no gender or race. Fear and ignorance is what they have in common. Both are deadly diseases, someone said. The othering, fear and death is what they have in common. Inequality to accessing healthcare and treatment. Okay, let's take about 1 more minute to allow people to respond if they haven't yet. Both are surrounded by disinformation, again, intentional dissemination of unscientific facts. Death, othering, fear and death have come up quite frequently. And also I've seen, I think once or twice, the issue around exacerbating existing inequity. Okay, we'll give it just a few more moments. The denial, discrimination, fear, death, and low self-esteem. Fear has come up quite frequently here when people think about the commonalities between COVID-19 stigma and HIV stigma. Thank you for participating and responding to that question. We will now move on to another, to the next set of, the next session in the webinar. And just to give you an overview of how we will proceed with the rest of this webinar. And before I do that, just to thank you all for participating and letting us know what perspectives you bring to this session. I'm sure that that was very interesting for the speakers to see. And we will bring in those perspectives that you shared as we move through the panel discussion that is coming up shortly. But to give you an outline of how the remainder of the webinar will flow, we will now continue with a very exciting panel discussion with speakers from various backgrounds who will share their reflections and experiences of how we can use the lessons from HIV to address COVID-19 stigma. As I mentioned previously, we will not use the raise hand function, and we will not take questions directly from the participants by allowing them to speak. But what we will do is to invite you to please note your questions in the Q&A chat box, as we will only select questions from there for the speakers to respond to after the panel discussion. Following the panel discussion, we will open up to include you in the discussions, and will then pull some questions and reflections from the Q&A chat box and the comments section of the Facebook live stream, which we will ask the speakers to respond to. So please, as I mentioned before, as you listen to the speakers, please post your perspectives, your questions, etc., in the Zoom Q&A text box or in the comment section of the Facebook live stream. We will conclude the session and the webinar with another Mentimeter check-in, and then we will share some resources with you that you can use to further explore the topic under discussion. Now we will move on to the panel discussion. And in order to get us started and to give us a little bit of grounding on personal experiences of people with COVID-19 stigma, I would like to share a recent news story from Al Jazeera on the impact of COVID-19 stigma in the Democratic Republic of Congo. And we will share screen and project the video, and hopefully the bandwidth will be strong enough for us to show the video and also for you to be able to follow.
As coronavirus cases accelerate in Africa, many patients who have recovered from the virus are facing stigmatization and discrimination. Despite beating the infectious disease, many still live under its cloud. In the Democratic Republic of Congo, survivors battle against people's denial of the virus and stigmatization against the sick. I am living proof the disease exists. I will ask people who still have doubts to be very careful, because I can confirm that I suffered. According to reports, people battling the virus have been threatened and ostracized in their communities. They face constant suspicion that they are spreaders of the disease. There's a stigma. When you know it's COVID, you're stigmatized. My children are nicknamed COVID in the neighborhood. They're called Corona. So when a child goes out to buy something from a corner store, they call my children Corona. That's the kind of behavior that drives people into hiding. As of Friday, the mineral-rich nation reported 5,283 cases and 117 deaths. To aid combat the spread of the coronavirus, the European Union recently announced that DRC will benefit from a 19.5 million euros humanitarian aid.
Yes, we hope that that news clip has further illustrated how COVID-19 is manifesting and becoming more and more widespread in Southern and East Africa, and that people who have been diagnosed with COVID-19 have been exposed to stigma because of their diagnosis. I will now welcome the speakers for this panel discussion and ask them, and I see that 3 of them have their video on already. You can feel free to take your video down when you're not speaking, in case that saves bandwidth where you are. But I think it's been working so far for the 3 of them, except for our 4th speaker, Reverend Anderson Mataka, who will join us, but is unfortunately at the moment experiencing some connection issues. He's joining us from Malawi. We will keep an eye out for when he joins and pull him into the discussion. But I'd like to introduce to you Gumisayo Bonzo, who is the Executive Director of TransSmart in Zimbabwe. Bonzo, do you want to wave to everyone? Can you? Bonzo, can you wave if you hear me?
Yeah, I'm afraid my connection is not very good, but it's breaking and I'm like getting back into the conversation. So just bear with me. That's Zimbabwe for you.
Yes, indeed. But this, at the moment, you are loud and clear. And we recognize the privilege at this time in Zimbabwe to actually have you with us.
Thank you, Felicia.
Yeah, the connection is not bad at the moment. So thank you, welcome. I'd like to then welcome Pim Looze, who is the HIV Stigma Index Officer at the Global Network of People Living with HIV, GNP+.
Hi, thank you for having me, and well done with my last name.
I tried, I practiced. Then I would like to introduce Chris Mallouris, who is the Senior Advisor for Community Support at the UNAIDS Regional Support Team for East and Southern Africa. Welcome, Chris.
Thank you for having me. It's a pleasure to be here. Hi, everyone.
Thank you.
And hello from Johannesburg.
I hope the weather is good today in Joburg and you're enjoying the spring weather. Throughout the panel discussion, we will post questions for you as participants to respond to through a Zoom poll. It will give us an understanding of how you, how you understand COVID-19 stigma and also HIV-related stigma, and importantly, what your understanding is of effective interventions to address this. And as I mentioned, we will welcome Reverend Mataka when he's able to join us. But without further ado, we'll get started with the panel discussion, which will be framed around a series of questions I will pose to all the speakers, and I will then give them 3 to 5 minutes to respond to each of the questions. My first question is, and it's based on what we just saw in the Mentimeter, popped up when people were thinking about the commonalities between COVID-19 stigma and HIV-related stigma. But actually, before I do that one, I've just come up with another question that I have. And I think it's one that might help us also further ground the conversation in a common understanding of some of the terminology that we use. So Bonzo, Pim, and Chris, can you share with us what your understanding is of stigma and how that links with discrimination? So, just for some of us out there thinking this phrase and this term is being thrown around, but what is it really? Can you give us your perspective and understanding of the term stigma and also what the link is with discrimination? Let me start with Chris, because at the moment, as a male, you're outnumbered. So I'll start with you and I'll allow the women on the panel a little bit more time to think through the question.
Absolutely, and this is where I quote my previous host, Mariangela, who whenever men were in the minority, we would join her and say, that's the correct gender balance.
That's the way.
More power. So for me, stigma starts, I remember this is from another discussion we had recently where someone said that health is constructed at home. And I was trying to figure out what that is. And it's the same for me, that stigma is constructed at home. It's that reaction we have to someone, to something that is based on that collective of experiences growing up or being where we are. That relate to the otherness, sex. And for HIV, it's about sex, sexuality, drug use, the otherness, but also death, mortality, illness, the difference between disease and illness. So it's that first manifestation of all these feelings that we get when we're confronted with something that then result in action. And that action could be discrimination, could be violence. And so I've learned so much the last 6 months, just as horrendous as this experience has been, about humanity and how we perhaps need to all change and transform the way we address stigma. It's time that we challenge stronger than before our own traditions and norms, that we challenge the way that health and education and social protection is not a commodity. It's a public good. It's a duty of the state. That the way that we need to challenge how we each approach each other, that it's about caring and loving and not excluding and fearing. But at the same time, start recognizing why are we afraid, you know, and some of that is real. And I've learned so much about stigma just leaving home and going to the supermarket. That's when you learn the most. I remember an advice from a colleague just when the pandemic was hitting and remember the impact that we've seen so far in this region is more on the lockdown than now we are seeing the impact of the epidemic itself. The advice was spend 20 seconds speaking to the cashier, the person who's going to put gas in your car, those who are out there providing services when everyone is at home safe. And then you learn. And so I try to do that, and I try to spend at least a minute with people. And you know, the most time I spend with is homeless kids in the street. Because the number has grown. The services that should be going up are going down. Their vulnerability is going up, is not going away. So for me, stigma is, again, going back, is about where whatever we've experienced or absorbed from our surroundings and about the other, about sex, about death, about illness, and we manifest them in a thought. And that thought then turns into the way we treat the other. And it's time that we look at humanity differently and learn and care. I can speak about more into the details on COVID and HIV later on, but for me, that's stigma. It's about humanity. It's about the heart.
Yeah. Thanks, Chris. Very well said. Bonzo, what do you have to add in terms of how you would define stigma and how you would define and maybe explain the link between stigma and discrimination?
Okay, so Felicia, for me, I think stigma comes in two ways. We have what we call self-stigma and the stigma that we get from the society. So maybe I would like to start by talking about the self-stigma. Hello, can you hear me?
Yes, yes.
Yeah, so I can start by talking about self-stigma, especially when we are looking at this COVID-19 thing. You know, this year, I don't think there has been someone who was able to even cough when you are traveling by public transport in fear of being like, you know, people looking at you like, really? Because they will think that you have this COVID-19.
Bonzo? Bonzo, are you there? Oh, there comes,
19 thing, and you know, with us people who are HIV positive and have got TB, you know, there are similarities with these COVID signs and symptoms compared to TB. And the moment you start to show those signs, no one will ever think of taking you to go and get tested for TB. They will just think that you have this COVID thing. And it comes with a lot of stigma from your family, from your friends, from your workplace. And the discrimination that you then face, you know, it's just too much. I think when we were diagnosed with HIV, we faced the same stigma and discrimination. So I think for me, it's dealing with the self-stigma that I may have upon myself so that I can be able then to deal with the stigma which comes from the society and also to be able to deal with the discrimination that comes with the whole thing from the society.
Yeah, thank you so much, Bonzo. Pim, what do you have to add to that?
Well, I think I completely agree with, like, I look at it the same way as Chris. It's who we are, the norms that we get, the way we are raised, how much we feel sympathy for others, even if we experience fear when we're faced in a certain situation. That all results in certain thoughts. and often stigmatizing thoughts, right? We see it everywhere. It's everywhere in so many shapes or forms. And thank you, Bonzo, for pointing out self-stigma, because I think that's often forgotten about, and it can make such a difference if we address that appropriately as well. And the link with discrimination, well, as the others mentioned, I think when there's stigma and that is turned into actions, that's when you see actual discrimination.
Mm-hmm. Thank you so much. And you know, the words that I took away from that was thoughts. Stigma is thoughts and feelings, and it's socialization, and it is the thoughts we attach to certain things, which is born out of how we are socialized, the kinds of things we're exposed to, but also that it is linked to fear and it is linked to shame. And that also brings us to the whole, you know, self-stigma, and something that Bonzo mentioned about, you know, how we view ourselves as well. The next question that I have, and I promise I'm going to try not to abuse my power as moderator and join the discussion. I promise I will cut down on the time that I spend engaging in the discussion and allow you to respond yourselves. The next question is, what, if any, similarities and differences are there between HIV-related stigma and COVID-related stigma, and how they are manifesting in our communities in Southern and East Africa? I will start with Bonzo. Do you want to start? Please go ahead. And then I will go to Chris, and then we'll end with Pim. Bonzo, please go ahead.
Yeah, you know what, I think, Felicia, is with this COVID-19 thing, we haven't got on other methods like the home remedies which are being posted and all that, and there's a lot of you know, people don't really understand what this COVID thing is, and by doing that it's leading to a lot of stigma within the community. And also I feel like our government has not addressed this COVID-19 thing. Hence the rise in the stigma cases which we are getting.
Thanks, Bonzo. Pim, what are your thoughts on the similarities and differences between COVID-19 stigma, HIV-related stigma, and how they are manifesting in our communities?
Well, I think there are really both similarities and differences, and similar in a way that, as we just discussed, stigma comes from this lack of knowledge, misinformation. Both are infectious diseases that have the possibility to end up with death. So there is a lot of fear, which also leads to a lot of stigma. There are also, of course, similarities in the consequences of stigma: social exclusion, isolation, bullying, gossiping, but also avoidance of healthcare and hiding of illness. There are, of course, also differences. HIV-related stigma is often quite complex. We see a lot of intersectional stigma. It's also mostly related or associated with high-risk behaviors, while COVID stigma, not so much. There's more this feeling of anyone can get it. We're all vulnerable. We're all at risk. And if you do get it, you had bad luck. So that's a very big difference, I think.
So true. Chris, what do you have to add to that?
For me, it's what really shocks me is the striking similarities and the striking differences. The similarities for me is that same groups are facing their vulnerability, their isolation, the violence they experience from authorities, from communities, is just amplified. And some of it is based on fear of infection, and some of it is just, you know, we have a reason now, another reason to be violent and exclude, and because they never belonged in our society. So sex workers are rounded up, and who is not a citizen, deported, or sorry, repatriated. That's the polite word that is used. And then we lose them somewhere in the border because they're not able to go from one to the other. They have no medication. Sex workers are then arrested because they don't obey lockdown measures. And therefore, they're taken to quarantine, no connection with families behind, kids left without food, with no treatment. It's the same issues, unfortunately, again and again. And some of what is different for me is that the discrimination and stigma for HIV was rooted on a virus, whereas the stigma and discrimination that we're seeing being manifested on COVID is mainly coming from lockdown measures and social distancing. And I think we need to actually, from my perspective, I'm trying to see where the stigma and discrimination actually, where inequity now starts crossing that line to discrimination and human rights violations. Not every child will have the ability to be homeschooled. Not every child will have internet access. And that inequity at some point becomes a rights violation. The mental health impact from lockdown measures. So it's that, and I know I'm not very articulate, but it's stigma and discrimination when you combine the different epidemics, and I'm not just going to talk about HIV, and actually I try not to, just because I work on HIV. I think we need to stop just focusing on where we come from, but really just take it broader in terms of what do we learn? What have we learned? So it's that, that collision of livelihood loss, economy's impact, health systems not delivering or accessible, education, illness and death, all of that, how it manifests into a world of human rights violations, a world where human rights are being, that fundamentality of human rights is being eroded. That point where we're left to think, who decides who lives and dies? Who makes that decision, and how is that based on stigma and discrimination and inequity and inequality? I cannot decipher anymore in my head what is it about stigma and discrimination and what is about inequality and inequity in our societies. I think in my head everything is colliding, and I'm trying to sort it out, or maybe we shouldn't, I don't know. But where I see the differences and where I see the commonalities, it changes from day to day. I'd like to offer one more place where I think there is a striking similarity, unfortunately, that then I think is deeply rooted to where stigma comes from, is the way we look at evidence. I had so many arguments with colleagues on when they try to present evidence on who dies more from COVID, and have to argue about, please distinguish between race and racism. There is a reason why certain races experience greater deaths. It's because their race leads to social isolation and poor health outcomes. And please do not factor out socioeconomic impact on health so that you can figure out the actual relative impact on people with diabetes or HIV from COVID. Factor them in, because health and socioeconomic outcomes cannot be separated. And that's the root of stigma and discrimination for me. Who's left in and out of health? Who's left in and out of life, of education? So it's a tremendous experience to be here the last few months and just really try and make sense of all of this. So I hope I answered the question slightly.
No, it was very interesting hearing your perspectives. And I mean, I think, you know, it made me reflect on some of the things that the participants mentioned when we asked the question around the commonalities between HIV and HIV stigma and COVID stigma. And they did speak about inequalities and inequities. And there was a specific comment, I'm just looking on my phone, I took a screenshot of what came out. And there was a specific comment about how both of these exacerbate existing inequities. and they're grounded in a lack of knowledge, and they're surrounded by disinformation. And, you know, I think, yeah, I agree with you that I've also seen some of those experiences and read about those in the Ebola response. So it's not just limited to HIV and COVID. I mean, I think somebody else had mentioned the word deja vu is what comes to mind when they think about COVID-related stigma. It's like we've been here before. And what is it that the universe and life and epidemics are trying to teach us that we're not learning? And it boils down to that inequity issues. And yeah, anyway, very interesting, very, very interesting to hear your thoughts. The next question is really looking at your experiences in addressing HIV-related stigma as coming from the organizations that you work with, the kinds of constituencies that you work with, and the experiences that you've had over 40 years of responding to HIV-related stigma. What is it that we can learn from interventions that are effective? Which are those interventions that are effective in addressing HIV-related stigma, and how can they be applied to COVID-19 stigma? Can I start with, Pim, do you mind if I start with you? And then we go to Bonzo and end with Chris?
Yeah? No, it's okay, it's okay.
Oh, Bonzo, do you want to go first? You seem ready.
Oh, I will miss what I wanted to say.
Please, and we must not tempt the connection. The network in Zimbabwe is precious.
Okay, you know what? I've just been thinking. You know, with this COVID pandemic, it's like us, the citizens. You know, we are like victims. We are like criminals. You know, the government is making us look like criminals. You know.
Bonzo?
Not the way they are doing with this pandemic, or we are, you know, I'm just confused. And I think when we were dealing with HIV, it was totally different from this COVID thing. And the way we are looking at COVID, it's like I am the criminal, instead of the government and us trying to work together to come up with a solution on how we can manage this thing, because, you know, it just came out from nowhere. We were not prepared. Everyone was not prepared. And for now, for people to say, you must not go and buy food. You must not move around without a letter from the government or whoever to go and buy food and all that. It's also making it difficult for us, especially the key population, the LGBT. Where do I get a letter? I'm a trans identifying person. Where do I?
Bonzo? Oh, I think we have.
I get a letter, we compare it with what is happening with HIV. It's totally different. With HIV, I could go and get medication. But with this COVID thing, I can't even get help from the health facilities, because I cannot even travel because I don't have the letter which requires me to travel.
Yeah. And that goes back to that point that Chris was making about COVID-19 stigma also being linked to the enforcement of regulations in this region and the measures that governments are taking to enforce and who's being targeted and etc. So Pim, what do you have to add to that in terms of effective interventions? What has GNP Plus been doing to address HIV-related stigma, and how can we learn from that?
So the program I work on is the PLHIV Stigma Index. In very short, it's a standardized tool with an accompanying methodology that gets implemented by countries. It is led by networks of people living with HIV to document experiences with HIV-related stigma and discrimination. It's not so much about the results itself or the study itself, it's about the process as well. It's a capacity building process. It's meant to be empowering. It connects people because it's an interview. It's a face-to-face, peer-to-peer interview. But of course, it's also about the results. It's about gathering evidence that can then be used for advocacy, to influence policies, to inform future responses. So I think we can definitely learn something from that. And first and foremost, I think that is that in order for our response to be effective, we need the communities most affected by it to be engaged and to be meaningfully engaged in the process. I think that's something we now all know, that we need this for our response to be effective. And second of all, I think what we've learned is that there is not one intervention that we can use to eliminate all types of stigma in all situations, for all population, in all contexts. There is no one-size-fits-all solution in addressing stigma, because stigma manifests differently everywhere in many different shapes and forms. What I do think about is when you talk about effectively addressing stigma, is the importance of measuring stigma, because we need to know what's happening in order to address it appropriately. And also in order to, for instance, prioritize or to come up with a strategy. We cannot do that if we don't know what's happening. So I think it's very important that we use reliable tools and a community-based approach to measure what is happening before we can decide on how best to address it.
Thank you, Pim. And that also speaks to the role that misinformation is playing in the COVID-19 pandemic. So true. Chris, what are effective interventions?
Yeah, so the way I think about this is there are interventions about reducing stigma, but in my head is about that collective of interventions that eventually change our attitudes and reduce stigma. That is not just about stigma. So I just have a few words here, which is about care. Provide care. Don't let people die alone without their family. Protect someone. Don't abuse your authority and violate their rights. Engage them. Uphold their dignity. Learn from the past and use your lessons. Challenge the norm. Whether it's in systems, in law, in society. Dare. We need to dare. Take a leap of faith sometimes and either fight for someone else or do something different. Measure stigma, but also measure the impact. Learn from evidence, but don't let evidence paralyze you. Serve. Provide services to people, whether those are health services, education, social protection, food. And I think for me, the last is empower, provide agency. Lately, I've been trying to think about our engagement in HIV and how to transform, and remembered what are the 5 basic needs of a human being. And one is health. The other one is shelter and security. The other is the ability to provide for themselves. Then as you go up, it's about feeling part of society, not excluded. The last one is, and is that ability to be able to have power, to make decisions on their own. I think if we provide a little bit on each of those 5, we will challenge stigma. I will add a sixth, which is allow people to dream something better. Allow people to think that there is something better coming, to fight back, survive, to think of a better world. And I really just, I'm not able in my head anymore to distinguish one response to one illness from another, or from how we engage in just societies. And yeah, as you can see, I'm struggling where I'm going with my work, but it's what I've learned from HIV that eventually is about challenging stigma and discrimination to ourselves as well as to others is put the person at the center, address their needs, ensure that they have self-worth, show them that they are worthy, and then we will be able to manage quite a lot more than just HIV and COVID. Thank you.
It was interesting, Chris, to hear you speak about the concept of hope and having something to hope for. And I'm just reflecting on, you know, when HIV was peaking in Southern and East Africa, and HIV was really seen, and AIDS was seen as a death sentence. You know, the devastation that it caused by taking away the most productive citizens and components of society, and leaving child-headed households, and the amount of fear that inspired, but also the role that treatment access then played in giving hope, but also in addressing that stigma that people with HIV would not be productive for very long because they're facing this death sentence. And in a way, this kind of, you know, how uncertain we are around COVID and how it affects people and who, you know, dies and which comorbidities and the kind of fear that there still exists because there is no vaccine at the moment, etc. I just kind of reflected on the role that treatment had played in really, you know, beginning to also dismantle that stigma and the concept of HIV as a death sentence, etc. I have one more question, but I'm trying not to be greedy because we only have 25 minutes left. It's an hour-and-a-half session, and I wanted to get in some of the views and perspectives from our participants and people who've joined us this afternoon. I will read out a few of them. I think there's about 5, and there are 1 or 2 questions in there. So please take note of those questions. And just to give you the heads up about my question, it is about building on the effective interventions we just discussed. What is the role of different players and stakeholders, and what can different stakeholders do to help address COVID-19 stigma? So while you chew on that, let me just go through a few of the comments that have come up and the questions. Very, very interesting ones. I've been, you know, sneaking off and looking at some of them actually. So the first one that I wanted to read out is, as having survived COVID, I was very much impacted by the way the messaging from government in South Africa is related to protect others, especially elders, while one still feels guilty for contracting COVID. And there seems to be some contradiction in how self-stigma developed in reflecting on the kind of messaging that is coming from government side. So that's one that you may want to respond to. The other comment that has come in the chat box is that in the COVID-19 response, we seem not to have learned that telling people what they must do without engaging them and empowering them to understand why they are instructed to take a specific action. An example is telling people to wash their hands and not trusting people with the scientific basis of such an instruction, such as the fatty lipid bilayer, which is destroyed by soap and washing hands. To what extent is this the same way we initially responded to HIV and allowed stigma to grow? And this is the lack of effective knowledge in effect. That was the second comment. The third one is from Maria Stacy, and she says, greetings friends, and thanks for this session. It's the easiest thing in the world to stigmatize. It's the way in which we humans deal with living in a complex world. It's almost the default way of thinking for humans. It takes serious and conscious effort not to stigmatize. It has to become a core value. Then a question that was posed is, how are you handling other conditions of upper respiratory in relation to COVID-19 pandemic, cause of similarities in stigma, fear of getting treatment to health facility? And I think this is one that Bonzo had touched on when she referred to the TB issue and the TB stigma, and about someone coughing in public transport. So maybe this is one that Bonzo would also think a little bit more about. The question being, how are you handling other conditions of upper respiratory conditions in relation to COVID-19 pandemic because of the similarities and the stigma, fear of getting treatment at a health facility. Then there's one that speaks to the mental health issues among sex workers, not being able to contribute with their life status and livelihood due to guidelines that have been put in place, stigma and discrimination and fear of reporting violence due to COVID-19 pandemic. There are issues around quarantine and isolation, and then how people people are defaulting on medication, HIV medication due to unsustainable conditions like access to food, shelter, health, because of the close down of hotspots, specifically in the context of sex work. And they also mentioned the lack of septrin for key populations or for people living with HIV. How have you handled this is the question. So maybe that is, if one of you feels comfortable responding to that. Then the last comment that I took from the chat box says, I think stigma is driven by a lack of knowledge, the fear of the unknown ignited by fake or false news and facts festering in the stigma, which is either projected or internalized. So that's another perspective on stigma. So I'll come back to the speakers and ask if you have any reflections or any responses to the questions and comments that I've just read out. Chris, you're shaking your head. Do you want to start? There's a juicy one that you want to bite into.
I could, So I was struck by that comment that was made. Stigma is easy; it comes naturally. And I wonder why. I'm being serious. I really do wonder why, because not all of us, but quite a large part of us grows up, at least the first few years, with that sense of love that we get from our caregivers, whoever that is. So I wonder what happens that changes, that our first reaction then is to push back others, to push away others rather than bring them in. And I don't know if it's the way that we've constructed societies. That's because that as we grow, we learn that you have to fight for yourself rather than count on support from others. I don't know. I really do hope that this is. I keep hearing that it's a different world after COVID. That we will be a different world, and I hope we do take that seriously and really think deeper than just providing care and treatment and vaccine, and really challenge everything. I was actually hoping that not to see the devastation of livelihoods, that the economy impact would have transformed the way that we are constructing societies. That it's not about large companies that are providing food, but it's the small farmers that are able to then engage in economy. That it's about really just redoing the education system and thinking how children access. It's about how we change health systems and so on. But I have this fear that we'll go back to norm after this. So I was really struck by the person who talked about stigma comes naturally, because I thought it didn't, or I was hoping it doesn't. And so what is it that changes in our lives, that from that love we get, we turn into something else? I don't know. Yeah. That's my thoughts right now.
Interesting. And we're allowed to differ and see things differently. Yeah, I just wanted to draw your attention to the box that's just popped up on your screen, which is a poll that we are taking through Zoom. And as I mentioned during one of my introductions earlier, it is about us just checking in with you about what you think are effective ways to address COVID-19 related stigma. And we have two poll questions for you. The first is, making the names and location of people infected with COVID-19 public will help to address transmission of COVID-19. So this is agree, disagree, or not sure answer. So is the next one. And the next question is, criminalizing COVID-19 transmission will help to address COVID-19 stigma. So please respond to those poll questions while we take the rest of the responses from the two panelists, and then we will come back to my question, and then we'll check in with what the responses to the poll questions are. So I will now hand over to Pim. Bonzo, should we take you, because we're not so sure about your connection? If there's anything from the comments or questions that I have read out that have come from the participants, if there are any that you want to respond to, please go ahead. Otherwise, we can give Pim an opportunity to respond, but I just want to check whether Bonzo is ready or happy to respond, because they have a connection issue. Bonzo, are you there?
Yes, yeah, I'm back now. I think when you asked some of those questions, I was offline again. But okay, what I may say is, looking at the COVID pandemic with people living with HIV and TB, we challenges like, for example, I cannot go and get my refill of my ARVs are closed. And the clinic which I was getting medication is near my place is closed. The later to travel to the nearest clinic which is available for me to go and get. And also you find that some clinics which we were using to get tested for TB, they are the ones which has been turned into the centers for COVID response. And it has been so difficult for the community, because we are forced now to go to the private, where they are charging a lot of money. People are charging in US dollars, and the vulnerability of the community, the HIV infected, we don't have the money, because most of us these are some of the challenges that are coming in when we are talking about the COVID-19. And also to say it is on our family to say you are also HIV positive, you have TB, now you are showing symptoms of HIV. There's a lot of gender-based violence happening in homes because of this, Felicia, and I just wanted to highlight this. And aging CBOs, CSOs, NGOs, especially in Zimbabwe, if they can also come in to help us, because at the moment, to frankly speaking, our government, I think, is failed us, and it's not in a position to actually deal with the COVID-19. But as a mother and a father, you cannot say, I have failed to look after my children. You will be putting yourself, So I don't know what can be done, but who is suffering is us, the community. I also feel that, involving the community, when we are talking about COVID-19, when we are talking about HIV, I think we made a step in HIV because we're involving the community, those support groups which we formed, and I think it helped a lot. But with this COVID-19 thing, I don't know where we are missing it, is the community and the government. Thank you.
Thanks, Bonzo. Thanks so much for that response. Pim, I will allow for your response. There are a few more comments that have come in, even one from Facebook Live. And I will get back to those once we've taken the comment from Pim on the first set of interventions.
Yeah, I was same as Chris, really like that comment struck me, that it takes serious effort to not stigmatize. And that's something I've also thought about a lot, because if you look at everyone as children, you don't see any stigma, right? So it is something in society that shapes us to make all these judgments and to stigmatize and then discriminate. And it needs serious attention and huge change before we can improve that. Because I saw there was a question on the Facebook Live, is it about a remedy for stigma? Yeah. I don't think there's one remedy. Like, I don't know how to start in answering that question almost, because it's such a huge task. It's going to require a lot of different attacks, right? And about the COVID response, having not learned from the past, I agree. There is such a lack of transparency, and it's so difficult to find accurate information. Also, of course, the information keeps changing. We keep finding out more, and it's really hard to keep track. It's really hard to keep track, even if you're in this public health world and you have access to all this information. It's really hard to follow. So I really agree that we need to change the way we make information available and make sure that it is easy to access, that there's accurate information, and get rid of as much misinformation as we can.
Absolutely. Just as as Pim was responding, and when you mentioned the Facebook Live comment, and then I saw that Bonzo had responded to someone's comment in the Q&A, and I just felt so proud about how you as panelists, and I saw Chris also had responded to a question that was posed or a comment earlier, and I'm so impressed by your ability to multitask because I'm struggling here trying to look at the questions and follow the conversation. But thank you so much, Bonzo and Pim and Chris, for having kept your eye on the Q&A chat box on the Facebook live stream, but also in the chat that the participants have been posting their questions and their comments. But I wanted to just remind you of my question. It is now 21 minutes past, so I will literally just read out these comments and questions, and then I will allow you to please, as part of the responses to these, also talk a little bit about the role of different stakeholders in addressing COVID-19 stigma, and you can speak specifically to ones that you feel have a particular role to help accelerate, us addressing COVID-19 stigma. And then we will conclude the panel discussion and move on with the rest of the agenda. So I'm looking at a comment that says, and I think this is the one that Bonzo had responded to. Let me just double check, it was in the Q&A. The comment that said, I'm living with HIV and I have seen my peers afraid of going to health facilities to treat opportunistic infections because of the fear of being diagnosed with COVID-19. This is due to the stigma associated with HIV and COVID, as both are viruses and have no cure. I think more sensitization must be done to avoid more stigma. And Bonzo's response that more sensitization is really needed, and messaging as well. It's about that addressing the myths also that exist around COVID-19 and also still around HIV. The other comment was just saying, I'm a 74-year-old Black woman, a 36-year AIDS survivor who defeated struggles with fear and with stigma that comes from intergenerational trauma, Black family cultural norms, cultural, institutional, and structural norms, as well as self-stigma. Thank you so much for that comment. And I think, this is why the kind of championing by people living with HIV was also so important in addressing HIV-related stigma. It's important to see people who have lived with HIV for so many years and have defeated stigma, who have addressed it, who have dealt with it. and still live to tell us about, you know, the things that they have survived, and also how they have been responding to these. So thank you so much for sharing that. There is a question, and Pam has already answered the question around the remedy for stigma. I think we spoke about effective interventions a little bit, so I wouldn't really, you know, want to take away more time responding to that, because Pam has also already spoke specifically about that. The one that I did want to raise was a question that came in even before we had the session, before it started. And I see that the person who posted that question is actually on the chat here, and the question was shared with me before we started the session. But the question really was about how COVID-19 stigma is impacting on people who use drugs. And this is not something that we had particularly asked the speakers to prepare for. Also, I know that none of them work with organizations that support people who use drugs or work on harm reduction issues. But I have a colleague who has been working on COVID-19 and impact on people who use drugs. So I will ask Hejin, sorry Hejin to put you on the spot. I know that you are online and you've joined us. But if you could just share some of what you are learning about COVID-19 and the impact on people who use drugs. Also maybe about some of the responses that ARASA has been supporting in this regard. And then I'll also allow Chris, I think had mentioned that he can speak to that issue. Please also speak to that, Chris. Let me allow Hejin, if Hejin is ready. Please unmute Hejin so that I can see whether you're ready or whether you want me to skip this. And then I will come back to the panelists. We'll start with Chris responding to the people who use drugs question, and then any of the other things that came in the last round. But then my question around the role of different stakeholders, and then I'll allow all the panelists to respond to that, and then we'll close the panel discussion and move on with the rest of the agenda, which is not going to be much longer, probably 10 or 15 minutes at the most. I know that people had only scheduled to be with us until, you know, for an hour and a half. So if you need to leave, please feel free to. If you need to leave at past, we will totally understand. But if you can stay with us until we conclude, we can also give you a little bit of information about the webinars that are coming up. So there are lots of interesting conversations still coming up in our series of webinars. So Hejin, do you want to speak to the issue around COVID-19 and people who use drugs?
Yes, I think it comes down to one thing is intersectionality. You're talking about a group that's already severely marginalized. You know, like other groups such as sex workers, and you know, people who use drugs, there's overlap with people who are sex workers, transgender people, etc. So you have a huge amount of intersectionality when it comes to any sort of public health issues, not just COVID, but TB, HIV. You know, questions about ability to keep yourself safe. How do you access clean water if you are a person who uses drugs who might not have a home? How do you access opioid substitution therapy? Is opioid substitution therapy being prioritized by service providers in the midst of a lockdown, where what is considered to be essential during a lockdown, for example, versus what is considered to be not essential? When you look at a country like South Africa that suddenly diverted a lot of resources within the health system towards dealing with COVID, what health issues are kind of sort of put second place or disregarded? And you see that people who use drugs, the specific harm reduction services that they need, are easily pushed aside because we live in a society such as South Africa where a lot of forms of substances are criminalized, where we've had situations already in Durban where the municipality in Durban said we will not even provide needle syringe programs anymore. So even before COVID, there was already an entire ongoing struggle of ensuring that that the harm reduction services in general are available. And when COVID struck, you see that the more intersectionalities in terms of marginalization there are, the worse it got when I'm not just working at ARASA, I'm also a board member of the South African Network of People Who Use Drugs. And you hear stories of people, people who use drugs who are essentially homeless or live in very dire conditions being rounded up and sent to what I would call camps for quite a while until civil society organizations managed to get them out of there. Where when curfews are being enforced, the police is always heavy-handed with people who use drugs, but even more so find justification to act with impunity towards people who use drugs. And that is really the intersectionality of criminalization of people who use drugs and the sort of almost impunity that comes with policing during a time when a state of national disaster has been declared or a state of emergency has been declared. While a state of national disaster should be for the protection of the people, the way it's been implemented has been very much in a lot of places in violation, at least as I see in Southern Africa. I can't really speak for other continents, has been very much in violation of a lot of human rights principles. And of course, the existing marginalization and stigma that people who use drugs face sort of makes them especially vulnerable for that. So it's a combination of them not being able to necessarily access service or services being interrupted. When they are people who use drugs, obviously there's a diversity. If you're a richer person who uses cocaine in your home, that's a very different situation than then if you're an injecting drug user who lives in very poor conditions. So you will find situations where you can't access services, you can't access the tools to keep yourself safe, and you're dealing with a police that feels emboldened to act with a lot more impunity, or even a national defense force. And at the same time, drug users are stigmatized as being dirty in general, as being vectors of disease, the same as trans people and sex workers. And such stigma really easily rubs off when a new illness comes about. It ranges from the very essential of a government that says wash your hands, and what you do when you don't have access to clean water. You're going to be seen as being irresponsible, while in fact you have no choice. There is no opportunity. To the very to a very forceful and violent response from government to seeing you as a population that needs to be more controlled than the rest of society. So some of the work that ARASA has been doing has been supporting. We've provided some support for organizations in Kenya and Uganda to provide emergency supplies, hand sanitizers, face masks, etc., but also to allow organizations to actually engage with the police when cases arise of what I would call, selective or over policing of people who use drugs, to just sort of shortly say so. But I think in any situation like this, when you kind of unleash the police or give government emergency powers and you have an existing system of marginalization and criminalization, you're always going to see people who are already marginalized, sort of, at the edges of society, being pushed out further and being targeted a lot harsher than the rest of society.
No, fantastic, Hejin, and that is such a good introduction to the session and the webinar we will have in a few weeks on regulations being enforced, enforcement, how it's impacting on marginalized groups of people, and then also access to justice. So what are partners already doing to help address some of those heavy-handed and acts that are happening without impunity against marginalized groups? Let me allow Chris to speak to the issue of people who use drugs. Also, we still have some reflections on the role of different stakeholders, and then we'll try to wrap this up.
Yeah.
Thank you, because I can see some people are already leaving us, and we don't want to lose more people, but thank you. Please, Chris, go ahead.
I'm not going to share any case studies because I just wanted to agree with what's been said. And it sounds to me that essential services are the services to those who have a voice and will trouble the government. So those who will not have a voice are not considered to need essential services. And even worse, those who do not have a voice and are not supported by others with voice. So drug users, prisoners. The first thing we saw was visits to prisoners will stop. It's just that what do we prioritize and what do we not? And so for me, what you said, what are the actors and what can they do? Leadership, political leadership that it's about cohesion, not division. It's about protecting people, not companies. Someone needs to do the calculation of the amount of money that went into solidarity funds for South Africa, that if you divide it by a population, how much goes to person, you know? I remember things like that. So, and I was wondering like, okay, how I learned a lot just by talking to people outside. Talk to the cashier at the gas station, and so the company Engem gets a subsidy, so they survive. I mean, they would survive without the subsidy. She gets her hours cut down from 5 days to 2, so it's getting by 2 days. So it's that what's essential and what's not essential is about who has the power to influence or put pressure on the politicians and leadership. So it's about leadership, whether it's political or religious or whatever. We need the leadership right now.
Great.
Yeah.
Thanks for sharing, Chris. Bonzo, I am always quite scared of the connection in Zimbabwe at the moment, and quite eager to get Bonzo in there before they disappear. And so hopefully, Bonzo, please, can you go ahead before we ask Pim to contribute? Yeah, please go ahead before, you know, I think you've been hanging on for a long time, so it's about to go any moment now.
Can you hear me?
Yes.
Okay, so on the role of stakeholders addressing COVID-19, you know, when we were dealing with HIV, we were all leaving no one behind. And I also feel that we can use the same approach where we encourage stakeholders not to leave anyone behind when we are talking about COVID. And also the deaf, the dumb, you know, like providing intern in Blair so that everyone gets the message. And I think looking at our government not being able to even the facilities, the things which are supposed to facilities, I think it's up to the stakeholders now to actually provide some of these things like the materials and even the support, the psychosocial support which is needed so that we can, you know, we can include everyone. And also, I think one thing which I feel I have to say here is the LGBT community, you know, we don't feel safe even to go to the health facilities, you know, to talk with HIV, to talk about COVID. The stigma already which we have been facing because we are a minority group, and to go there and say, you know, I think I'm suspecting that I have COVID. It's a very painful journey for the LGBT community. You are asked a lot of questions. By the time you go out of that health facility, you've been having challenges. If reaching to the facility, you reach the health facility, you face this stigma and discrimination. I feel that stakeholders must also come, you know, which are trans-friendly, clinics which are LGBT friendly. So I'm just putting it to stakeholders to say, if you can chip in, we can have those mobile clinics where our members can go and access healthy care services, even to go and get tested for the COVID-19. I think it would help to actually solve the stigma and discrimination which we are facing.
Okay, great. Thank you so much, Bonzo. Pim, please go ahead and add to that.
Yes, so to add to that, I think it's really important that we learn from our mistakes. So we need all stakeholders to be honest, to reflect what went well, what did not go well, be honest about that, admit the mistakes, and we can do better. We can learn from our mistakes. So I think we should take that opportunity, but then we really need people to be honest about that. And what we need to keep doing is we need to keep listening and learning from the community. We cannot do it without them. We need to know the barriers they are facing and what they feel we can do to help break down those barriers. Let me not make it too long.
Thank you for that. And thank you so, so very much to all of you for this very stimulating conversation. I mean, I have learned so much, not only from you, but also from the questions and comments and input that came from the participants. Thank you, speakers, for sharing so generously, and thank you for even agreeing to join this panel. So thank you so much. As we move towards the end of the session, we want to go back to mentimeter.com. Actually, before we do that, let me just share with you the outcomes of the poll. And I've taken a screenshot and I have to kind of go back into my phone again. So there we are. So the question, should we make the names and location of people infected with COVID-19 public in order to address transmission of COVID-19? 87% of people disagreed, but 7% said, yes, we should. And 7% said they're not sure. 87% though, the vast majority disagreed and said this is not a good idea. Then the question around criminalizing COVID-19 transmission and whether that will help address COVID-19 stigma. Interesting that 77% of people disagreed. So still a majority of people disagreed that criminalizing COVID-19 transmission is not a good idea. 17% said they're not sure, and 7% agreed that we should criminalize HIV, COVID-19 transmission. So just in terms of ARASA's response to these questions, it's a no. We disagree with both questions. And you can join us for future conversations to learn a little bit more as to why we think that those responses and that those suggestions are not a rights-based response to COVID-19. So as I was mentioning, before we conclude, we just want to check in with the participants again to get a sense of, you know, where you are at the end of this conversation. So please go back to the menti.com platform. So it's menti.com and use the code 4937020 in order to respond to our first question. So it's menti.com and the code is 4937020. And the first question is, in a few words, what are your main takeaways from this session? So please feel free to share with us, what are the main takeaways that you have taken from this session? What are the main things that you have taken from this session? What has stood out to you? You can use simple words or you can write a sentence, but we just wanted to check in with you at the end of this conversation. What are your main takeaways? So again, we're asking you to go open a new window in your web browser. So open a new window, type in www.menti.com and the code 4937020 and share with us some of your main takeaways from this session. Some of your main takeaways from this session. Some of my main takeaways are just the similarities, the vast similarities between COVID-19 stigma and HIV stigma, be it around misinformation, be it around fear, be it around shame, and how it's grounded and exacerbates inequalities and inequities. So there's one very brave person. If this was a face-to-face meeting, I would have given you a prize. Oh, 2 people, okay. Okay, it's getting a little bit competitive. But I would have definitely given these 3 people now, I would have given them a prize. The first person says the drivers of stigma and how they intervene effectively are still a bit of a mystery, as it involves such fundamental social change. And that's what this person is taking away, is that there's still a lot more kind of unearthing of the drivers of stigma that needs to happen in order for us to effectively address it. Another person says, infectious diseases seem to always induce fear, which leads to stigma. We often react out of fear almost automatically. That's what this person is taking away. And HIV and COVID-19, their main concern, and if it comes to stigma in particular, is fear. That's fantastic. Okay, I think we can move on to the next question. Oh no, there's one more. Let's quickly check that one. The main takeaway is that fear and panic regarding COVID-19 give inappropriate responses. They're not based on science or proportionality, similar to those around HIV criminalization. Fantastic. Thanks so much to the 4 people who shared. Hejin, I actually think, okay, let's see. Let's take 1 or 2 minutes to look at this question, and maybe we can then just move on to share some of the resources, because I think we've really stretched out the session already 15 minutes after we were supposed to end. So the last question that we will look at in this round before we conclude is, what can we do to address COVID-19 stigma? What can we do to address COVID-19 stigma? And what are your takeaways around what we can do to reduce COVID-19 stigma? Encourage fact-checking of information and counter misinformation. I think that's a good one. It was very effective in addressing HIV-related stigma. It was about addressing the myths and the fears that people have about how HIV is transmitted. And that helped to reduce the stigma. Again, this would have been the person that also received a prize from me if we were face-to-face in a meeting room. Thank you for being the brave soul. Let's give it 1 more minute, and then we can move on to share some resources and close the session.
Hello.
Hello.
My name is Anderson.
Oh, Reverend Mataka, thank you for joining us.
I'm so sorry.
That's all right.
My network was very poor.
Yeah, that's okay. We are moving into the closing of the session. It was very, very interesting.
Yes.
But there are more webinars coming up, and hopefully you can join us for another one to share some of your perspectives on addressing COVID-19.
I'll be glad to do
and
so.
A human rights-based response. Thank you, Reverend Mataka.
Mm-hmm.
Yeah, okay. So there's a few more. Actually, there are 3 more responses that have come up to addressing COVID-19 stigma. The one being that sensitization associated with COVID-19 is important. Educate, educate, educate. Storytelling. I don't know what EDU is, but hope gives courage and strength to handle stigma. So those are some of the things that we can do to address COVID-19 stigma. Thanks so much to everyone for joining that and taking part in that poll. We appreciate it.
Thanks so much.
Okay. Now we will just share with you some resources on addressing HIV-related stigma and getting to understand it a little bit more. But also, there have recently been quite a few resources developed on addressing COVID-19 stigma. And we've added those. There's about 3-4 of those in the list that we have in front of you. Feel free to take a screenshot or to use your camera on the phone to take a screenshot, but we will actually share these with everyone who had registered for the webinar. So we will send you an email with these links that you can just double click on or click on that will take you directly to those resources. Some of them are from civil society, including GNP+, including ourselves and Frontline AIDS. And then there are some that are from the UN system. And there's also some recently that have come up that includes the International Federation of Red Cross and Red Crescent Societies and some of their partners, including UNICEF, WHO, etc. We've been talking about social stigma and how to address stigma related to COVID-19. And with that, we are moving towards closing the session. But before we do that, I wanted to share with you the titles and some of the topics that we will be covering in the upcoming webinars in this series. There's one coming up in a week, I think, in about 2 weeks, on the 8th of September. And this specific webinar will look at how do we realize the rights to sexual and reproductive health during the COVID-19 pandemic. It will really look at whether sexual and reproductive health and rights services are essential services during this time, and what stands at risk. What do we stand to risk if we do not ensure uninterrupted sexual and reproductive health and rights during the COVID-19 pandemic? 2 weeks later, this will be followed by a webinar on accountability for financial resources made available for COVID-19 responses. And that's some of the things that Chris, I remember specifically, was also talking about accountability during a disaster and emergency, state of emergency being declared, and being able to circumvent some of the procurement regulations that may exist in different countries, and what is our role in holding people accountable and stakeholders accountable for financial resources that are being made available for COVID-19 responses. And then 2 weeks later, we will have a webinar on the enforcement of COVID-19 regulations, how this impacts on marginalized communities and their access to justice. The final webinar in our series will look at the gendered impact of COVID-19 in East and Southern Africa. We'll look at how regulations, etc., are impacting on women, on LGBT communities, and what others are doing to help address the gendered impact of COVID-19 in East and Southern Africa. We look forward to welcoming you to those webinars. We will post the registration links on the ARASA website, but also on all our social media, and send it out to our partners for registration. As I said, the next webinar is coming up on the 8th of September, so please look out for that. We will announce that very, very shortly. But with that, we have come to the end of our very, very exciting webinar this afternoon. I had so much fun, and I had such a learning curve. And I hope that you also enjoyed the discussion and hopefully learned a thing or two. I would like to thank you for joining us this afternoon, and for those who have stayed until the end of the session. I know that we need to manage time better. That's my fault, my mistake. I will try to do better next time. But I specifically want to thank the interpreters who've helped us communicate throughout the webinar. I appreciate that it is very difficult to do this over an electronic platform when we are also faced with technology and other challenges. And then I would like to thank the speakers who joined us today for sharing so generously their experiences and their knowledge and their skills. And I want to thank the organizations that they represent for their continued solidarity and their support. And I just want to thank the ARASA team who has helped and played such a big role behind the scenes to make sure that things were happening smoothly and that we were able to pull off this very first one in a series of webinars that we are very, very excited about. And with that, I want to wish you a good day further. We'll speak again soon. Goodbye.
Bye-bye. God bless you.
Bye. Thank you.
Bye-bye, everyone.
Bye.
It was nice
Bye,
talking to you. Bye-bye.
Bye.